I want to talk about what is actually happening when your knee swells up, because we talk about a lot of like just getting rid of inflammation. You need to get rid of it, get it out of your knee. But why does the body do this? And I think it's really important to know this because it might change the way that you think about swelling, and it's not always a really bad thing. So looking at the actual method of how, or physiology of how our body produces swelling, I'm going to share my screen and share a picture with you guys. So this is what's happening at the cellular level. Sorry, let me grab my own camera here. Okay, so this is what's happening at the cellular level. When we have an injury, now this is, they're talking about a wound here, but the same thing happens when you have an injury inside your knee joint, even if you didn't break skin. When there is an injury, what's happening is your immune system already starts right away. It sends cells that are carried by blood to the area. So you have your lymphatic system, and then you also have your arteries and veins, which move blood. So they're going to move different cells to that area to help clean up right away. So you have your macrophages, your phagocytes, your mast cells, neutrophils. These are a lot of fancy words, medical terms. But these cells are coming in to literally eat up anything that's dangerous or harmful to the body. It's going to take that up, and then what it's going to start to do is it's going to start to lay down new tissue, and that's what the repair process looks like. So you can imagine if you are trying to stop this inflammatory cycle right as it's happening, you're telling your body, don't bring all these cells to the area. Don't clean up this. Don't lay down new tissue. Don't repair tissue, right? And so if we stop that process, we're stopping the healing process. So some swelling is not a bad thing, especially if your body is bringing blood to an area. It's for a reason. Now, sometimes there can be too much swelling, or your body starts to produce or stay in an inflammatory cycle. And if you find that you're constantly in this inflammatory cycle or constantly having swollen knees, then we need to get to the root cause of that problem. And I would highly recommend doing my Chronic Knee Pain Fix course, because that's going to help you actually get to the root cause of, maybe it's your movement patterns, maybe something's weak, maybe something's imbalanced, not doing its job. That is what's going to actually get rid of your pain once and for all, and get rid of the swelling once and for all. It's not just doing these techniques to help relieve your swelling. That's going to help temporarily, but if it continues to happen, there's a reason why. Okay, so another thing that I like to look at is, I'm sure you guys have all heard about RICE, right? Rest, ice, compress, elevate. That's what we used to tell everybody to do. It was from a study back in the 60s and 70s by one guy, and he published it, put it in a book, and it blew up. For whatever reason, it was in every textbook, every newspaper, all that kind of stuff. And our medical system kind of just adapted it. He came back decades later. This was, not that long ago, maybe 10 years ago. He came out and said, sorry, just kidding. There's actually no research behind what I said. Ice does not help, and rest does not help. So sorry about that. So we still have people that are resting, icing, compressing, and elevating, even though there's zero science backing it. We know that it does not help. If anything, it actually hinders your healing. So our medical system, or physical therapy, really has come up with peace and love. Now it's a lot longer, but there's science behind it, and we know that it works. So what it looks like is, the P is for protection. So you're going to initially avoid any activities or movements that increase your pain right after injury. So say you hurt your knee. you're probably not going to go run that same day or the next day. You're going to avoid some high impact, some things that you know are definitely going to cause you some irritation and pain. E is for elevate. You're going to elevate that leg. Now that one is still good. You want to elevate it above your heart. So make sure that it is elevated above the heart line. So you're laying flat. Your knee is elevated above your heart so that it actually has gravity working with it to bring that blood flow to your heart to pump it out the rest of your body. Because if you just have your leg hanging down or you're sitting or laying with your leg down, the only place it's going to go is down into your foot because gravity is going to do its job. A, avoid anti-inflammatories. So this is probably a new one for you because you've been told, oh, just take an anti-inflammatory. Take some Advil, take some Tylenol, whatever it may be. That's not going to help you because by taking anti-inflammatories, you're stopping that inflammatory process that the body is doing to reduce tissue damage naturally. So it's that natural healing process. So if you're doing the opposite, you're not allowing your body to do its job, right? The other thing they have in here is avoid icing as well. That's an anti-inflammatory, right? So we're not icing. C, compression. That's another one that lasted, that stayed. Compression is still good. You want to push that fluid again up your body so you can wear a knee sleeve. Massage helps. Again, you got to push it up your body though. Don't push the fluid down because if you push it down, it's just going to go to your foot. E is for education. The more you know, the better, right? Knowledge is power. I say that in so many of my videos and with my clients. This is why I do these videos because I want you to know what's going on with your body. I don't want you just to have some exercises. Here, go do these exercises. If you don't know why you're doing what you're doing, it's not going to work. It doesn't matter if I give you the perfect exercises. If you don't know why your body's responding the way it is, what it should feel like, all of those things help you recover so much better and so much faster than you going in blindly or just following, 5 exercises here or there, an exercise that you find on the internet. Moving on to love, we have L. So once you've gotten over peace, which is going to be the first day or two, then we are going to start to actually exercise safely. So load. You want to load the knee to gradually get you back into normal activities. This is what a lot of people don't do. They avoid loading, right? They avoid movement altogether. And that's just hurting yourself. Your muscles are getting weaker. You're going to be in more pain because your muscles are weaker. You're going to be stiffer because you're not moving. And you're going to be in more pain because you're stiff, right? So we want to load the knee safely. This can be body weight exercises. This can be isometrics, but you definitely don't want to do nothing at all. O, optimism. You'd be surprised how much the way you look at your injury mentally plays a big role into how you recover. Our brains are very, very powerful. If you have negative self-talk, examples would be like, oh, I'm never going to get better. I'm going to be in pain the rest of my life. I'm never going to be able to get back into the things that I love. Negative, negative, negative. Your body will start to respond that way. I always say with my clients, there's a reason why placebo effect works. When they've done it with cancer patients, they've done it with a bunch of diseases. People will take sugar pills thinking that they are taking the medication to cure whatever they have, and their body naturally starts curing that disease with a sugar pill. So your brain can be very, very powerful. I want you to start thinking optimistically. Your body is strong, your body is resilient, and you have the knowledge and you're doing the right things to help you recover. Vascularization. So you want to increase your blood flow to help repair the tissue. Again, this is involving movement. If you don't move, that blood flow is not flowing. Nothing's moving. And you're not getting new cells to that area to help clean up. So movement is medicine. It is so true. It's not just a phrase. It actually is the truth. And then lastly, exercise. So you're going to restore natural, your normal exercise routine, restoring mobility, strength, proprioception, to allow for full recovery. So this is what we're going to follow instead of rice.